Okay. So the framework includes all the components that are required for the proposal, and community engagement is there in the middle of this framework because it's at the heart of this work and will be woven throughout these 6 steps. So today we'll talk about collecting data to determine today we will talk about collecting data to determine your cancer focus and your population of focus, and to understand the significance of the problem that you wish to address. We'll end our session today discussing how to establish goals for improvement. On March 31st, we'll talk through finding and selecting evidence-based interventions that fit your population and context, as well as how to adapt them for an even better fit. On April 14th, we will cover implementing and evaluating evidence-based interventions, focusing on developing a project plan for your proposal that includes a timeline and a budget. So before we get started with that first 3 proposal components, I thought we could introduce ourselves. If you don't mind sharing your name, your title, and what organization you're from, and maybe a little bit about what you do in your cancer focus in just a few words. Who would like to start?
I'll start. Hi, good morning, everyone, or afternoon. My name is Fernando Diaz. I am a hematology oncology fellow with an interest in geriatric oncology. And so my research focus is on disparities in the Latino cancer population here in North Carolina. That's the one-liner.
Thank you, Fernando. Would you like to pick someone to go next?
I think Paulette would be great.
Thank you, Fernando. My name is Paulette Duggins. I am president of the Angelic Warrior Foundation. My cancer focus is colorectal cancer. My goal is to raise awareness about colorectal cancer and to fundraise to provide support for patients, caregivers, and families. And I'm especially interested in raising awareness about early onset or young onset, as we call it.
Thank you, Paulette. Would you like to pick someone to go next?
This is Jennifer Park. I can go.
Go ahead.
Good afternoon, everybody. This is Jennifer Park, and I work with the North Carolina Division of Public Health with our NC Partnerships to Increase Colorectal Cancer Screening Program, NCPICS. And so I'm the program manager for the NCPICS program, and it was hard to think of 3 words or less, Mary. I would say like decrease cancer impact.
Nice.
Okay, and Nora, have you gone yet?
No. Good afternoon. My name is Nora Jones, and I'm the president of Sisters Network Greensboro. We are a African-American breast cancer organization, and our focus is to improve breast cancer treatment outcomes for women of color. That's it. I mean, in a nutshell, what we do: breast cancer for African-American women.
Great. Who would like to go next?
I'll go.
Okay.
Hi, my name is Patty Murillo Casa, and I come to you from New York City. I am the New York City Survivor Ambassador. We are a group of cervical cancer survivors, but I also lead a group called Survivor Slim Down, which is powered by Survivor. And where we take cancer survivors, all kinds of survivors, and we educate them on health, fitness, nutrition, everything that has to do with health, to provide them with healthy choices and stuff like that, to prevent any kind of to prevent cancer completely. I am a cervical cancer survivor, myself, and I'm also a personal trainer and a group fitness instructor. So we lead this group just to, take our life beyond cancer and prevent anything else. Thank you.
Thank you for joining us today, Patty. Would you like to go, Sharon?
Sure. Jumping right in. My name is Sharon Brown Singleton. I am the Director of Revenue Enhancement and Special Projects at Med-North Health Center, which is a federally qualified health center in Wilmington, North Carolina. And we are looking at reducing the colorectal cancer screening, increasing our rate of colorectal screening rates using FIT testing.
That's great. We're going to talk about that a little bit today. So that's wonderful. Who else is yet to go?
I'll
Alana?
go.
Okay.
Yes. Hi, my name is Aline Rohasha. I am the QI coordinator at Triad Adult and Pediatric Medicine. And our focus is to improve screening rates as well in our clinic, colorectal cancer screening rates.
Great. All right. I think that was everyone. Speak up now if you didn't get to go. And we'll just keep moving. Yeah, that's a great idea, Paulette. If you all don't mind including your name and organization in the chat just for a quick reference. And then I think that'll be saved for the recording too. Thank you. Okay. So as I mentioned, the first component of the proposal is the project overview. We're going to briefly touch on this component today. The project overview includes the cancer focus or the cancer problem that you plan to address, and the population or the description of the community or populations targeted by your project. And when thinking about your population, you'll want to consider those both directly and indirectly affected by the selected cancer issue. So the last section of the project overview is the planning stage. And this is simply where you'll let us know in the proposal if you will be finding and selecting an evidence-based intervention as part of your project, or if you already have an EBI and you're ready to implement and to evaluate it to address your identified cancer-related problem. So for the purposes of this training, we're going to start with our cancer focus and population predefined. If you're still determining your own cancer focus and population for your proposal, I would recommend using some of the same data sources that we're going to discuss in the upcoming slides to help you narrow your focus. But for today, we're going to say our cancer focus will be colorectal cancer, specifically increasing screening rates, and our population will be adults eligible for colorectal cancer screening in Chatham County, North Carolina. So in your proposal, it's also important to include experience working with this community if possible. So for example, if I were to write a proposal focused on colorectal cancer screening, I would mention my previous experience working as an evaluator with Jennifer Park on the NCPICS project, as well as evaluating the American Cancer Society quality improvement learning collaboratives focused on colorectal cancer. So now we're going to jump right into the second proposal component, which is called the significance. And this is where you'll detail how and why the problem you are focusing on is a high priority for the intended population. And you'll want to provide as much data as you can to document the problem in your specific population and describe how input from your key partners and the local community guided the focus on the selected problem. So in order to explain that significance of your problem, you'll need to review existing data, especially at the county level in our case. So we're going to search data for this example to assess the colorectal cancer incidence and screening rates in Chatham County, North Carolina. So here are some sources for data to help you conduct your assessment. These are just some examples. We've included a comprehensive list in the handouts that I sent in an email that you're free to look at more closely as you have time. But for today, we'll walk through a couple examples together. So to find the colorectal cancer screening rates in Chatham County, I'm going to go to this website, called the State Cancer Profiles. This website is linked on your resource list. We also can put it in the chat. Let's see. It's not letting me copy it, but it is in your resource list. Anyway, so from this website, you'll go on the down to that drop-down list and select your state. So we'll select North Carolina. And then that will take me to this page where you can browse state-level cancer data. So after selecting incidence on the tabs up top, I'll look down until I can find that colon and rectum cancer line. And then here I can see the different rates for North Carolina and for US. So here I can see that the North Carolina rate is a little bit lower than the rest of the country. To get the county level data, I'm going to click on this map symbol over here. And this takes me to this page where I can select the data I want to see on my map by county. So under the data group, I want to make sure to select screening and risk factors. And for the screening and risk factor, or let's see, and for the topic, I'll select colorectal cancer screening. And then for the screening / risk factor category below that, I selected the home-based FOBT in the past 2 years or ever had a colorectal endoscopy. So once you have selected the data that you want to see, you can then press that big red button to generate your map at the bottom. And here's what our map looks like after we click the generate the map button. If from here you can hover your mouse over the different counties and the little screening rates will pop up. So if I were to hover over Chatham County, I can see that the screening rate is 58.3, which is way down in the orange category. So we can see right away that there's some room for improvement. Now it's your turn. I hope you were paying attention. We can put this link in the chat. And
So Mary, can we go back to that slide? So is that, and looking, I'm just trying to understand what the data point is saying. Is that the percent of screenings that are completed for eligible individuals?
Yeah.
Okay.
Yeah. So now we're going to move to our activity, and I can click back through these slides if you want. And you should have access to the slides to reference. But I want you to take some time. We can take a few minutes and see if you can go through the steps I just did for your county or your state and find the colorectal cancer screening rate. And then once you find it, include it in the chat here so we can all see. I'll type out this link for you so it's easier for you to copy. Any questions so far while I'm typing this? There we go. And let me know if you want me to show any steps again.
This is Nora. I'm not the best at technology, so
Yeah.
again, do I have to get out of this to access this link here?
You shouldn't have to get out of it. Is there a way that you can minimize Zoom, make it smaller? If you're in full screen, it might be hard to see, but like on mine, I'm able to minimize it in the top right corner. Or do you see your bar at the bottom of your computer where there's all the icons for like for your internet browser?
Are we supposed to copy this and paste it in the browser now, right?
Mm-hmm. Yeah.
Okay. Well, why isn't it allowing me to copy?
I'm not sure.
Because you have to retype it into the URL
Oh, I have,
area where you would type a website.
uh,
You know how to copy and paste it instead of typing it letter by letter? You can just highlight it, Control C, and then paste it onto your web browser.
I think sometimes some people have trouble with the chat not letting them copy from the chat.
right. It's, okay, let's see.
Has anyone else found their rates yet? Oh, here's something. New Hanover County, 30.9.
I've
I'm
made it
having-
into a link. You can click on the link now. It's in the chat.
Thank you, Fernando.
I'm having trouble finding my county once I click on the map.
Okay. So you're here, you're at the map
Let me see your screen.
Before that, before that.
before that?
Yeah, I'm right here. I'm right there.
Here,
Yes. Mhm.
okay. And you're not able to find your county? Or I
Well,
guess-
it says to hover over it to see the rates. I guess your county, but I don't know. I see the colors. I don't know which one is my county.
Oh, right. Well, you can hover over until you find it. That might take a while. There's a lot of counties, or I would recommend searching a map of North Carolina where you can see all the names of the counties.
What's your county?
Yeah, or what is your county? You can try to find
Forsyth.
Forsyth.
It's going to be up by Orange County, towards the middle.
Unfortunately, when I hover, it doesn't tell me the county, so that's, I don't know if it's supposed to, but it doesn't.
If you click on it, will it do anything?
So you,
Okay, now I see. Yeah, I see now. Sorry.
That's okay.
There are ways to access besides using the map. This
Mhm.
website has all different ways you can get at the information, so it might make sense for folks to play around with this on their own. It's just a wealth of information that it might take a little playing with to figure it out.
Mhm.
But we probably,
so I did it
You've got time, Jen.
I did doing the exporting the data as opposed to the map.
Okay, yeah, then you'll probably get an Excel sheet.
Look this way. Yeah,
We can take just a couple more minutes and then we can move on, and this is something good to practice too beyond the training. Did anyone else find their rate that they can share?
Is it possible for the rate to be, it's between the two colors? It's, you know, like 33.0 to 37.4.
Is that the screening rate or the colorectal cancer rate?
And then, I'm looking at incidence rates.
Mhm.
Sorry.
Okay, so let me go back. So I want screening. Table. Great.
Okay. Well, I'm sorry to say we probably better, oh, there's another rate. 37.7. Now, is that screening rate or colorectal cancer incidence rate?
That was incidence.
Yeah, okay. All right, we're gonna move on. I'm sorry there was not quite enough time to really get used to this tool, but it's a good thing to practice and use on your own as you have the time. Okay. So after you've played around with looking at existing data, finding your screening rate, the next step will be to conduct additional research looking into what might be contributing to your lower screening rate in your county. You can do this also by reviewing the literature and existing data, as well as collecting new data and gathering input from your community partners, as well as creating your own maps and diagrams of processes. So one thing I want to bring up too, as you're thinking about the different factors that might be affecting your rates, this model here is called the social ecological model, and it can be really helpful when we're to keep in mind when we're thinking about our factors. Mapping the different factors to the appropriate levels of this model can help you understand sort of the dynamic interrelations between multiple factors, and it can help you think through ways that your intervention might be able to target factors at different levels. So keeping this in mind, let's as a group brainstorm what some barriers to colorectal cancer screening might be. Can anyone think of any?
I know in the past we've had issues with them forgetting to bring the test back.
Yes, that's one.
Not having enough specimen to read.
Oh, yeah.
Insurance, a lack of insurance.
Lack of insurance is a big one. Yep.
On an individual level, the lack of understanding of the different modalities for colorectal cancer screening.
It can be overwhelming. There's so many different options, and how do you know which one to pick? It's a good example. Any others?
It's kind of along the same. Yep, go ahead. I'm sorry.
Sorry. Access to healthcare, period.
Yeah. Yep. You might even be insured, but you might live far away or not have a car.
That was mine.
Okay, great. So now I'm going to share some that I had included on my slide, and we'll see how many we got as a group. So lack of health insurance or primary care provider, talk about that. Cost. Okay. Lack of transportation to colonoscopy or to pick up and return a fit kit. Lack of provider recommendations. Language barriers. Fear or embarrassment. Forgetfulness, someone brought that one up. And lack of interpersonal support. And these are just some examples. So now I'm going to talk a little bit about another resource that you can use to try to find some contributing factors at the county level. And so this website is called County Health Rankings and Roadmaps, and there's also a link to it in your handout. From the homepage of this website, you'll click Overview in the drop-down list under Explore Health Rankings. That'll take you to this page, and from here you can type the county that you're interested in the box that says Find Data by Location. So this will take you to the overall health outcome rank for Chatham County. And as you see here, Chatham is ranked one of the healthiest counties in North Carolina. To quickly identify possible factors, way down at the bottom, I'm going to select Show Areas to Explore and Show Areas of Strength. Then on the same web page, you'll just scroll down further, and that will take you to this table here, where I can quickly see, using the different color codes, what the areas of improvement and strength are. So the colors labeled red are areas to explore, and the factors that are labeled purple are areas of strength. So the three areas to explore in this case are all related potentially to colorectal cancer screening: adult smoking, adult obesity, and uninsured. The low rate of physical inactivity in the county could be a strength when it comes to lowering colorectal cancer risk. And then the other three areas here are factors that we might be able to leverage when thinking about a potential cancer screening intervention, such as the higher level of primary care physicians, the increased level of preventable hospital stays, and high flu vaccination uptake. So you can see that this population is accessing care in different ways. Okay, so we've discussed reviewing existing data to identify factors contributing to our rates. Now we want to talk a little bit about collecting new data. And this might be in the form of interviews, focus groups, surveys, public meetings, or direct observations. So you want to make sure to work with your community partners throughout this whole process. Your partners often will have in-depth knowledge about the local context that's invaluable to designing your survey or your interview guide. And I'm just going to talk about interviews a little bit today, but the interview process is very similar to the process that you would use for focus groups or public meetings. Direct observation may just include something like taking notes during a meeting or observing a process, or even scanning an environment like a pharmacy or a clinic to see what's there and kind of checking off the checklist. Let's see. And so just keep in mind that when choosing your data collection method, you'll want to be mindful of the resources that you will need and the number of people that you'll want to talk to, as well as who should be at the table. So it's important to engage the community partners who have, as I mentioned, the in-depth real-life knowledge related to your project. So potential community partners may be your hospital partners, providers, staff, or patients, as well as government agencies, or in some cases, academic partners. Who are some community partners that you all work with? You can put them in the chat or come off mute if you'd like. Does anyone have a community partner they work with? UNC, Cancer Services, Novant, LabCorp, those are big partners. Your own gynecologist or oncologist. Okay, those are good examples. Going back to our story for the training, you decide that you're going to interview clinic staff to identify their priorities and the factors contributing to lower screening rates in Chatham County. So talking with your community partners, such as the clinic staff who are actively conducting colorectal cancer screening, will help you understand the context around the barriers and the factors a lot more than a literature search will. So your community partners have information that they can share with you based on their experiences. So in the next slide, I'm going to talk about how you could plan a simple interview as a way to collect data from your clinic partners. So before you start the interview, you want to think about what you want to get out of it. So it's really helpful to think of, 1 to 3 overarching questions that you'd like to answer with the interviews. So some examples of those might be, is colorectal cancer screening a current priority for the clinic? What resources and staff time does the clinic have available to work on a screening intervention? And lastly, what barriers to colorectal cancer screening are encountered at the clinic? Next, once you have these main questions that you want to know written out, you can start to plan the actual questions that you'll ask in the interview. So these are just some tips when you're thinking about questions to ask, what you might want to avoid. The first one to avoid are yes/no questions or close-ended questions. Close-ended questions often don't get much deeper than a one-word answer. These questions can work sometimes if you use the appropriate follow-up probe, though, like if you say something like, or ask, does your clinic have a provider champion? They may answer with a simple yes or no, but if you follow up with a question asking them to tell you a little bit more about that or explain the reason for their answer, you can get a little bit more information. The next type of question to avoid is a why question. And that's because it can come across sometimes as confrontational, or it might imply that there's a right or a wrong answer to what you're asking. So it's best to avoid them if you can. A lot of times a why question can be reworded. So for example, instead of asking a clinician, why are your rates so low? You might ask, what do you think is impacting your current rates? Another type of question to try to avoid is a leading question. They should be avoided because they might lead people down a path of a fixed response option. And they can tend to suggest an answer that you want. So they can be kind of assumptive. For example, if you ask, how satisfied are you with your rates? It may lead them to say that they're more satisfied than they would have if you had just simply asked, how do you feel about your current rates? So you're more likely to get to the root of what they're actually thinking if you avoid a leading question. So the last type of question to avoid is a double-barreled question, which is essentially two questions within one question. So they might confuse the respondent, who may only answer part of the question, and you might not even know which part of the question they're referring to. So it can lead to some confusion and incomplete answers. So it's best to just ask those two questions separately instead of in one sentence. So now that we've covered, now that we've covered the different types of interview questions and what to avoid, we're going to practice writing some questions. So here's one of our overarching questions that we want to answer with our interviews. What would you ask your community partners in order to answer this question? Our question is colorectal cancer screening a current priority for the clinic? Take a few minutes to think about it. If you can think of a few interview questions, what would you ask? Does anyone have one to share?
I have the one that came off the top of my head, but I haven't analyzed it based on what you just gave us. But the first question that I came up with was, where does colorectal cancer screening rank on your list of priorities?
Okay, so that's a good question to kind of see how colorectal cancer relates to others. It might be a little close-ended. They might just give you a number, or but you can always follow up and ask them to give you a little bit more information. But I think that's a good way to start to get the conversation going. Let's see. Go ahead.
I was going to say, what's a better way to ask that so that it's not close-ended?
Right. Let's see. Maybe just tell me about your clinic's priorities, or what are your current priorities?
Gotcha. Thank you.
Colorectal comes up.
Okay.
Looks like we have some questions in the chat. What do you feel are some barriers to patients getting colorectal cancer screening? Yeah. In your opinion, how is colorectal cancer prioritized at this clinic? That's a good one too. How questions get at, there's a lot that someone can say and respond to a how question. Any other questions? Okay, for the sake of time, I'm going to keep moving. So here are some questions that I came up with before we started. So like, tell me about your clinic's current priorities. Tell me about current colorectal cancer screening initiatives at your clinic. Or how do you feel about your clinic's current screening process? Just some examples of questions you could ask. Okay, we're going to jump right into another activity. So I have 3 questions here, and they're maybe not the best questions ever. So starting with that first question, how do you think we can make it better? The question, why are your screening rates low?
Well, you already told us that the why question puts the person on the defensive. So that would not be an appropriate question to ask.
Right. How
Or,
could we make it better?
yeah, like you said, you probably asked, how do you feel about the screening rates?
Yeah,
And-
you could ask that instead. Mhm.
Mhm.
Or you could ask, what do you think are the barriers to higher screening rates, or something to that effect, one of the barriers?
Yep, that would get at reasons why they might be low. That's a good one. Okay, for the second one, do you have a colorectal cancer screening champion at your clinic? What's wrong kind of with that question?
Sounds like you're asking both, like a double barrel pre and post. I think they can be siphoned into two independent
Oh,
questions.
yeah.
Oh, I'm sorry, I'm looking at the last one. I'm so
Yeah.
sorry.
I was like, oh, yeah, no,
Okay.
you're
yeah,
right.
Apology.
That's okay.
It's closed-ended.
Yeah, the second one is just close-ended. So you might reword it in an open-ended way, or be prepared to follow up with another question. Okay, now the last one. Can you tell me about your pre and post-visit screening process? Fernando.
Well, you're asking two questions that may not have anything to do with each other. So you should likely break them up into two independent questions. This is a double barrel, of course, that you mentioned a question, two questions in one.
Yep, exactly. Nice job, everyone. Okay, I'm going to move on to the next, where we are talking about now summarizing the data that we gather. So here's a template that I like to use that you can use for note-taking during your interview or your meeting. You can also use it afterwards if you recorded your interview and you maybe have a transcript that you're reading. But it's a really helpful note-taking tool. So to make this table, you'll just list your interview questions on the left side, and then add a brief summary answer to each of the questions on the right. And some things to keep in mind with your summary. You want to just keep it really simple and use even just bullet points for complete thoughts. You don't even need complete sentences. It can be helpful to include notes like the question wasn't asked, or the question was asked but not answered, so that you know you didn't miss something. And you just want to try to summarize it so that anyone who's reading the summary can get a good sense about what was said during the interview without having listened to the interview. And if you can add any quotes, that can be helpful too. So here's an example of a very simple summary, what it might look like with these questions. Like, tell me about your clinic's current priorities. Maybe they said COVID vaccinations and CRC screening. Tell me about your current colorectal cancer screening initiatives at your clinic. Well, maybe they told you about a quality improvement collaborative that they recently joined to improve their screening rates. And lastly, how do you feel about your screening process? They've told you that they don't feel that great about the process because they don't have a great way to track their kits. And here's a nice way to reference a quote. It's helpful to write quote in front of the quote so that you know that you're directly taking that from the person who said it.
Mary, how do you feel about recording and transcribing later so that there's a more natural flow, and so that the interviewer doesn't have to, kind of look down and can make eye contact with the individual?
Yeah, absolutely. Yeah, I definitely recommend that. And I recommend, if you are using a template like this to take notes and you have someone else with you, maybe have that person take the notes and you can ask the questions if you're going to do it this way. Or if you're recording it, then you have a lot of options and you can do all kinds of different coding, analysis, summaries afterwards with the transcript. We're just going to keep this really basic and kind of high level for this purpose, for this training, but there's lots of ways you can go about it. Were you going to say something, Jennifer? No, okay. So back to our story. After conducting our interviews with our clinic partners, we concluded that improving fit tracking is one of their priorities. And they also told us that transportation is a current barrier for their patients. So you and a group of your partners decide to have a meeting to further talk about what you learned and decide where you want to intervene. So now we're going to move on to the next component of the proposal, the SMART objectives. So when you're like from all the data that you've collected, you can start to establish your SMART objectives. And these are just some questions that you want to ask yourself, as you're collecting your data and as you're writing your objectives. Which demographic has the lowest colorectal cancer screening rate? Perhaps that's where you want to focus. What factors are contributing to the current colorectal cancer screening rates? We talked about those with our existing data that we found. Which of those contributing factors are most important and most changeable? So in the next couple of slides, we're going to talk about how to think through that. And you also want to ask yourself, what resources do you have available to address the problem? Like, how much can you actually make a difference given your current funding level and staff time? What factors are a priority for your community partners? So you want to keep that in mind as well. Here are a few different ways that you can, tools you can use to prioritize your factors. One is called a nominal group technique, which is just where you brainstorm to generate a list of ideas, or maybe you have the list of ideas you generated from your data search and anonymously rank them in your group. Another is called multi-voting, which is just multiple rounds of voting to narrow down your long list of factors. And the third one is one I really like that we'll talk about in the next slide. It's a strategy grid or a matrix of 2 scores with two criteria, like something like need and feasibility. For example, if your factor was health insurance, that's something that, the need would be high. Everyone needs health insurance, but the feasibility might be low in the case of a $20,000 grant. It might be difficult to change the health insurance policy with that, that little of resources. So it's important to think that through. So going back to the factors we've identified so far, from the existing data, we found adult smoking, adult obesity, which I'm missing here, and uninsured. And then when we had our conversation with the clinic partners, we identified the difficulty tracking fit kits and the lack of transportation. So then if you were to put those factors in a strategy grid, you might do something like this, where you have your factors on the left, and then you're going to think through how feasible it would be for you to fix each one of these, and also how important it is, or what the impact would be if you do or do not fix that factor, for lack of a better way to put it. So if I filled this out here, for adult smoking and adult obesity, I would say the feasibility would be rather difficult, because improving something like this might require a more complex clinical intervention or even cultural or policy change around thoughts about smoking and obesity. Although the need would be kind of medium, I would say, because we're actually focusing on colorectal cancer screening rates. And these two factors don't necessarily affect screening rates. They're more risk factors for colorectal cancer. So they're not as related to our current project. For uninsured, that one's medium for feasibility, may require policy change or lower cost services, which might be hard for us to change. The need is high because insurance status directly impacts screening rates. And we saw that it was an area for improvement in Chatham County. Then the fit tracking factor, the feasibility is fairly high. That might just include changing some clinic workflows and adding some tracking logs. The need is also high because it directly impacts the clinic's ability to screen more patients. Transportation, I call that one medium for feasibility. You might do something like a mailed fit intervention, but that can be costly. And the need is high because that also directly impacts the patient's ability to be screened. So let's say for our story here, we decide we're going to intervene on the fit kit tracking and the transportation, because they were also high priorities for our community partners. Okay. So once you have that first, let's see. Okay, now that we know where we want to intervene, we can start to write our SMART objectives based on those. So SMART objectives are goals, objectives that are specific, measurable, attainable, relevant, and time-based. So when thinking about those objectives, you want to ask yourself who your target population is, what's your desired outcome, and how will that be measured, and what will be considered a success, how will you know that you reached your goal, and what's the time frame you want to complete that goal within. So essentially, your objective is going to explain how much of what will be accomplished by when. And this is really important. We're going to want to see in the proposal that you have a clear goal that you can measure, that's actionable, and you have a time frame. So here's a goal right here, and it's not very smart. Increase screening rates. What do you think we could do to this goal to make it a little more smart?
At a percentage of what how much you want to increase, and potentially a timeline of when you want to have it accomplished.
Perfect. Any other specifics we could add? What about the population?
Yeah.
Okay. So here are some examples of SMART goals that we might write based on the factors we identified. Maybe we'll say we'll create and implement a new FIT tracking system in 2 Chatham County clinics within the next 6 months. To address transportation barriers, we'll implement a colorectal cancer screening mailed FIT intervention in 1 Chatham County clinic by December 2024. And lastly, by December 2025, Chatham County colorectal cancer screening rates will increase by 10%. So these are just some examples of what you might write for a goal. What do we have next? I think that is everything for that first section. I went kind of quickly. We had a lot to cover, but we have some time now if anyone has any questions.
Can you go back to the last slide, please?
This one here?
Yes, thank you. I just wanted to take another quick look. Okay, thank you.
And Mary, I will just add that this is a really important part of your application, is to be really thinking about your SMART objectives, because these will drive your plan and your evaluation, which are 2 things we're covering in session 3. And so really thinking about what it is you want to accomplish, that you're writing in this very specific way, and then that will, and making sure that connects to your plan for what you're going to do to achieve those objectives, and how you're going to evaluate that you achieve those objectives.
Yeah, that's a great point. Thank you, Jennifer. Each activity that you'll include in your plan will tie right back to achieving your goal that we talked about today, or your objective, I should say. Any questions?
Could you send us the link for the application? I don't remember. Call for proposals.
Yeah, the proposal's open on the 14th. Veronica, is there a way for anyone to see it ahead of time? Oh, you're muted.
Oh, I'm sorry. Yeah, I thought that was the deadline for whatever reason, and I was going to start scrambling.
Oh, no, you've got some time.
I had a long night. I'm so sorry.
That's okay. No worries. Were you going to add anything to that, Veronica? Yeah, if you're that unmute button can be hiding sometimes.
That's exactly what happened. I was like, I can't get to it. I apologize for the delay, guys. But yes, actually, if you'd like to see it as we're working through the sessions, we definitely can have that as part of the mailing with the next mailing of materials and follow-up from today. I'm not sure the next time you have to send something, Mary, but we can include it then.
And then maybe in the last 5 minutes, if there are no questions, please complete this post eval. Let us know your feedback. We use it to make these trainings better. At 1 o'clock, you'll also be getting an email with this in the linked in the email. Could you get the handout? The handout's also going to be sent in that email. I can double check that you're on that and forward it to you if you're not.
Are we gonna get the recording too, Mary?
I would like to find a way to get you the recording. We did that last year. I'll have to check with the CPCRN folks to see if we can get it. Is everyone comfortable with this going on YouTube so I can link it to you all?
Yes.
Okay. Okay, so any other questions?
I had a question regarding the proposal. Are these 3 trainings required before you could submit for the proposal?
Nope. Just optional and hopefully helpful.
Mhm. Okay. And will there be any guidance